Hi, I'm Salem Mayor Dominick Pangallo, and thank you for joining us for this conversation with the team from Salem for All Ages about what the initiative is and what we're working on now to make Salem a more age-friendly community. I'm joined for this conversation by the co-chairs of Salem for All Ages, Patricia Zaido, Lisa Peterson, who's also the Chief of Staff in the Mayor's Office, and Norene Gachignard, who will be taking over for Patricia in the coming months as a co-chair of the initiative. Salem for All Ages is an outgrowth of a program that was started by the World Health Organization called the Initiative for Age-Friendly Cities and Communities. We received our certification from the World Health Organization and AARP in 2017. It was actually the third action plan certified in the Commonwealth. We were the first city on the North Shore to receive that certification, and one of the first 30 or so around the nation to receive it. And it was a result of a lot of effort that went into a needs assessment, a lot of surveys, focus groups, data collection that created this action plan that advanced in a more age-friendly community where people could live and age with comfort and dignity and the services that they would need to do so. So we had a number of successes in our first 5 years, which ended in 2022. I was proud to co-chair that effort with Patricia through those 5 years. We really tackled this work by breaking it down into a number of discrete areas that were identified in the action plan. And one of those was around information. So we created a website that had, and still does, salemforallages.org, has a wealth of information about resources in our community, programs, services, ways you can age in place here in Salem. We also created the resource guide. This is a publication that's updated regularly, mailed out to Salem residents when they turn 65 with all kinds of really great information about those programs and resources. So we make sure that everybody gets access to that. Patricia and I initiated a series of articles, columns in the Salem News. So those were taking place monthly for a number of years with guest writers talking about all the different activities, events, programs, and services for older adults in our community. And we also created a speaker series, the Salem for All Ages speaker series, where we brought really a great diversity of people of interest that had stories to tell, that had lessons to impart, that were there to inspire people. And that speaker series took place at the Community Life Center over those initial years of the program. Really also proud that members of the task force, which was the entity that was responsible for implementing the Salem for All Ages plan, had the opportunity to take our show on the road, so to speak, and we visited over 30 different communities in Massachusetts, even across New England, talking about the age-friendly certification program, what went into our own action plan development, and how we are working to put it into practice in Salem. So it's really been an effort to share the good news about age-friendly certification and all the ways that can help everybody in the community, not just your older adults, but the caregivers and children of older adults, people that work in the city or your town. Really a tremendous program that we're trying to help others understand what it means and how important it is to try to accomplish those goals. One of the other task force committees was focused on transportation and connection. And if you're familiar with the Salem Skipper program, we're really proud of that. It's an outgrowth of Salem for All Ages. We received a grant from the Tufts Health Plan Foundation to conduct some initial studies around the idea of an on-demand public transportation service. And we were able to launch that program in December 2020. And it's given just tens of thousands of rides since that point in time, $2 for regular fare, $1 for seniors and students. Really, while it was a program that started out of Salem for All Ages and was intended to provide a even more convenient way for older adults to get around our community, it's found a great base of support amongst people who are workers and employees, students, just across the range of people in our community. So it's a tremendous program that we have thanks to Salem for All Ages. We also, in those first 5 years, managed to secure some funding from the state to update our what's called the Americans with Disabilities Act Transition Plan. The ADA Transition Plan is a document that about half the cities and towns in Massachusetts have at this point. We're proud to have one, and it outlines really the gaps that we have in meeting our accessibility goals in our public facilities, in the manner in which we conduct public meetings, online access, and it provided a great checklist for us to be able to prioritize in the city's capital plan how we were going to make our information and our services more broadly accessible and really meet the goals of the ADA and of Salem for All Ages. So, no action plan is perfect. We have to adapt, and as I mentioned, we were in that 2017 to 2022 period, and in that time frame, there was a global pandemic, which really kind of threw a curveball to Salem for All Ages. And one of the things that grew out of that was a Salem Together initiative, which was a volunteer effort to provide well-being check-in calls on our homebound seniors throughout the initial kind of most traumatic early months of the pandemic, but really also a strong focus on food security, and that's maintained through the work of our health subcommittee today. Food access is critically important. We want to make sure that nobody in Salem goes hungry, and that's especially important for older adults who may be more income limited or have less ability to get out and access food services. So those are really, it remains a major priority for Salem for All Ages even to this day. We're proud of the work that the Health Subcommittee's been doing in that space. So where are we now? 2022 is come and gone. Salem for All Ages is entering a new phase of its existence. And while the work is pivoting a little bit and some of the leadership is changing, they will remain committed and focused on really having an age-friendly community. So we want to talk a little bit about what comes next. So with that, I'm going to invite the other guests here to talk a little bit about some of the goals for Salem for All Ages in 2023. Maybe we can start with the Lockbox program that was recently announced. Lisa, I don't know if you want to share that.
Sure. Thank you so much, Mayor. I'm so excited to be part of this initiative, to be a new co-chair of the Salem for All Ages initiative. And the Lockbox program is brand new. A lot of thought went into creating it. It was an effort that came together from the City of Salem, the Salem Police Department, and Salem for All Ages. And the idea is that it will be an important tool for helping anyone who wants to age in place. So if you are 60 years or older, you can get a lockbox at your local hardware store and call into the police department and register your lockbox code. And you can leave a key in there to your home, and that way if anything happens to you, then the police will be able to get in and help you. And that will be so important to make sure that you're able to stay in your home for as long as you want to. So if you do want to register it, there are a couple ways to do that. So you can email the police department at ciu@salempd.net, or you can call the police department at 978-744-0171. And if you do have any trouble affording a lockbox, just reach out to those numbers as well, and there is some help there for you if it is an issue. But it's a wonderful program. We're really excited to be rolling that out.
Great, thanks. Another new initiative is, I talked about the resource guide generally for Salem for All Ages and the importance of our focus on health and wellness. So our health committee has created a health and wellness resource guide very specific to that. Noreen, do you want to talk a little bit about that?
Sure, thank you, Mayor. The health and resource guide will be mailed to every Salem resident in the month of their 65th birthday, and it is quite an exhaustive guide of resources for health and wellness. We're very proud of the work, and it's available in English and Spanish. And it's about 15 pages. Patricia, help me.
It's about 6 pages in English and 6 pages in Spanish. It's a little different than the guide that we've been putting out on everybody's birthday at 65, much like AARP. This is focusing primarily on all of the resources in terms of physical and behavioral health. And Noreen is an authority on that, being a nurse, and she's approved of it, which made me happy.
It's a very exhaustive guide with a lot of great resources. And behavioral health is really sort of our focus going forward, because that is becoming a big issue with older adults.
Thanks. That's actually a great transition, because one of the other focuses for the Health and Wellness Committee is really trying to prioritize behavioral mental health. It's a tremendous challenge we're seeing at all age ranges, and we're focused on it as a community, in our schools, in our community, but also for our older adults. So we're using some of our American Rescue Plan Act funds, our ARPA funds, which are federal COVID relief funds, to engage with a specialist in creating a communications effort around behavioral mental health. So focusing on printed materials, presentations, webinars, consultations, to connect our older adult population with the resources that are available specifically related to overcoming behavioral health challenges, accessing services, discovering that what kinds of things might be reimbursable or fundable through different health insurance programs, and connect you to the resources that are available in our community and across the region. We're excited about that. That request for proposals is out for our consultant to come work with our team, and we're looking forward to getting that campaign underway in the coming year. So the other focus for Salem for All Ages, which if you've been down Canal Street, you might have seen the billboard already or seen some of the materials online. A heavy emphasis in this coming year is around an age discrimination campaign. There are a lot of myths about aging, and unfortunately, many of them perpetuate a lot of the discrimination and stereotypes about older adults that this initiative is attempting to address and overcome through education and through public information. So we're going to take some time in the program today just to talk a little bit about common myths about aging. It is something that we'll all experience if we're fortunate, and I think that it's something that's important to all of us. So, Noreen, do you want to start us by maybe walking through some of the myths about aging?
Sure. And thank you, Mayor, for mentioning that if we're lucky enough, because old age is a privilege not granted to all. I lost my husband at the age of 57. So if you are fortunate enough to grow older, it's unlikely that you're going to lose your memory. This is my particularly favorite myth because I've had a terrible memory my whole life. I don't worry about becoming forgetful as I get older because I've always been forgetful. I just have a terrible memory. And so that's, for me, one of the biggest myths of aging, that people get forgetful as they grow older. It's just not true. Another common myth is that you can't teach an old dog new tricks. Again, the ability to learn never declines. You can learn at any age. Older folks are non-productive. Well, here we are, Patricia and I, being quite productive, thank you very much. And the last myth on the slide, old age leads to senility. Again, it's a very, very small proportion. I'm not going to give a number here because I'm not going to get it right, but it's a very small proportion of older folks who become senile or experience dementia as they age. It's just a very small proportion of older folks. So, and again, old age means you're going to end up in a nursing home. I think it's 5% of older adults who wind up in a nursing home or a care facility. Elders are rigid in thought and action. I repeat, here's Patricia and I being quite flexible and active. And old people are all exactly the same. Please, as many different youth, there are as many different older adults. Go spend 1 hour at the Salem Senior Center and experience the diversity among the older adults. Old folks have one foot in the grave? I don't think so. We're running, we're walking, we're swimming. I happened to participate at the Salem Y in a water aerobics class, and I think the median age in the pool in the morning is about 70. So we're all trying to stay in.
Thanks. So I mentioned the campaign. This effort is Defeat Age Discrimination today. We've got, in addition to the billboard, you may see the social media advertisements, the videos, a lot of local people that viewers may actually know some of these folks, and they tell their stories of their own lives that defy the myths and advocate for this idea of positive aging. And you'll see more of these as this campaign unfolds. And Patricia, do you want to talk a little bit about what age discrimination is, how you define it, how we recognize it?
Age discrimination, or ageism, is exactly what it says it is. It's discrimination based solely on your age. You can be really interesting, you can be knowledgeable, you can have experience. It doesn't matter. If they look at you and they see an old person, they figure incompetent, uninteresting, unexciting. I don't want really too much to do with them. Think about what that does to somebody's self-esteem, their sense of respect. And you know, some people say, well, it's not as toxic as sexism or racism or anti-Semitism. It's actually more toxic. And the reason for that is because most of us aren't aware of it. We don't really dislike old people. We don't want to be mean to them. It just seems that America for a long time has accepted age discrimination without even realizing it. Do you ever get a birthday card, Noreen, that says, "Over the hill"? What about ads? A $1 trillion industry that wants to sell you wrinkle-free cream so that you will not age. It's anti-aging. Let me tell you something, you're going to get wrinkles, okay? Let's talk about positive aging. And besides being toxic, and besides being really engraved, yes, in our culture, the pandemic has made it much, much worse. Look at the people who died in nursing homes, and now they're saying it wasn't really necessary. Look at what is said on television and by personalities and politicians. Bill O'Reilly, he said, they're old anyway, they've got one leg in a grave. The Lieutenant Governor of Texas, he said, they should be really willing to give up their life. After all, it will help the economy. We say that we like old people, but we distance ourselves. We certainly don't show them respect. And when things get bad, we neglect them, and sometimes we really affect their physical and their behavioral health. Now, I know what some of you are thinking. You're saying, wait a minute. I really like my mother. I'm really good to my grandfather. What are you talking about? And of course, many of us are, but unfortunately, more and more are not, and that's a huge problem. How do we communicate with older adults? Well, we're more authoritative. We just don't want to speak to them for any length of time. We take less time with them. We get and lose patience with them. We don't really like talking to older adults, and we communicate with them in a much different manner than we do with any other age group. So, can we talk about how we should effectively communicate with older adults?
Yeah, let's give some examples of ways that people can maybe communicate effectively with older adults and help break down those barriers and make connections. So we have some examples we'll share, and then maybe you can each expand on these. The first one is think about stereotypes and generalizations about older adults. Recognize these perceptions can influence interaction and affect meaningful communication. Lisa?
Thank you. Yes. So what's the first thought that you have when you hear the term senior citizen or elderly? Physically, do you think of them as fragile, sickly, or weak? Well, how about active, healthy, working? How do you think of them socially, withdrawn, uninteresting, out of touch? Well, how about instead outgoing, enthusiastic, engaged? How do you think of them psychologically? Depressed, insecure, unmotivated? Well, how about happy, caring, and positive? Don't make preconceived judgments. Adapt your communication style to the individual.
The next example is for communication is do not patronize. Norene.
Yeah, do not use simplified vocabulary and endearments, dearie, young lady. There's evidence that people are more condescending and have less patience when interacting with older adults. People spend less time when communicating with them. They take more authoritative positions and they provide less information. Obviously, you can see that this attitude makes it impossible to have a meaningful communication experience for the older adult.
Patricia, pay attention to nonverbal behavior.
This is a big one. Many people never think about that when they're communicating, and yet research has shown that 90% of the time, people make decisions not on what you say, but what you do. What's your body position? How about your facial expression? Are you smiling? Are you frowning? Eye contact is huge. You know, there are some people who don't look you in the eye. Now, maybe they're shy. Maybe they're confused. Maybe they're not aware of what they're doing. What do we think about it? We think they're sleazy. We think they're not telling the truth. And it's interesting, we don't shake hands as much anymore, but when we did, it better be a good, strong handshake, because that makes you a weak person if you don't have a handshake that shows how powerful you are. Your voice, your tone of voice, all these things, in most instances, is how people make decisions about what you're saying.
The next example for communication is ask and listen. Lisa?
Yeah, make sure we're asking open-ended questions. Listening fully to the responses. We shouldn't assume what a person is going to say. A common complaint of older adults is, no one ever listens to me anymore.
Number 5, talk to the older person. Norene.
Yeah, oftentimes an older adult has a companion with them as they're attending whatever kind of a healthcare meeting or an appointment. But you need to speak directly to the older person. For example, as I just said, always recommended that you bring someone with you to a medical appointment, especially when you may be there to find out the results of tests and so forth. The reason is to have another set of ears for the person to listen and take notes.
Next example is to avoid ageist assumptions when providing information or suggestions. Patricia.
Assumptions are a big thing. First of all, is an interesting phenomenon that takes place. As people age, somehow their children think they need to become the parents, and they turn parents into children. You must involve them in decision making for their pride, for their self-esteem, and because you know what? They won't do it unless they're involved in it. We make assumptions about so many things. All Italians eat only Italian food. Young people, oh, they're terrible. They just make decisions and they just don't understand anything. And we make assumptions about older people too. We assume that when everybody turns 60, they're exactly the same. Maureen mentioned this in the myths, okay? They'll never change. Well, you know what? Some won't. And you know what? Some will initiate the change. They will have the creative ideas. Most of them, if you talk to them and explain things, if you give them good reason why this change is a good thing, and if you allow them to question and interact with them, they'll take and agree to the change.
The 7th example of the 10 is to help internet-savvy adults discover online options. Lisa?
This one drives me crazy, Lisa.
Well, don't assume that older adults would not be interested or capable of learning about online services. Share this information as you would with younger adults. There's a form you can use for this at salem.com. You could say, don't be surprised when they respond, oh, thank you, that's what I'll do. If they're not sure or have questions, help them learn. Remember, the internet has been around for a long time at this point. Most older adults know how to use it. On the other hand, some don't want to use it no matter what their age. There's people of all ages that want to avoid the internet or social media or for whatever reason. So it's not necessarily specific to an age if somebody doesn't want to use it, but a lot of people, most people of all ages are eager to engage with the internet. So don't make those assumptions.
Noreen and I do know how to ask Google.
Yes.
Especially since I think in the last 3 years with the pandemic, older adults' fluency with social media and communications has really become critical.
Of course.
Yeah.
So it's-
Social media, Zoom, all that stuff. Yeah.
Absolutely.
All right, our eighth example for communication is providing information is important, but how you give information may be even more important.
Patricia touched on this a little bit. So some older adults may have some limitations, visual or auditory. It's important to know that. But it's also important, I think, for any age, if you're going to give important information, to use the following suggestions. So you want to pick a place that has minimum background noise if possible. Turn the TV off. Turn the radio down. You need a quiet environment so people can hear and absorb information. You want to face the person directly so they can see your face. This was really tough in the pandemic when everybody was wearing a mask and you couldn't see people's mouths moving. But hopefully we're past the masks and you can see people's mouths moving and you can see their facial expressions, and that gives a lot of information. So facing the person directly on the same level, in good light when possible. You want to speak clearly, slowly, distinctly, but naturally. You don't want to be shouting or exaggerating mouth movements. And then you want to listen. Using silence encourages the older adult to speak. Be accepting. Yes, I hear you. This signifies that the listener has heard and understood. You want to give a broad opening. What would you like to talk about? Where would you like to begin? Restating. Repeat the main idea expressed by the older adult. This makes clear to the person that an idea has been communicated effectively. Exploring. This is really important. Tell me more about that. Could you describe that a little more fully?
The ninth example is successful communication involves establishing common ground. Patricia?
And that takes up right where Noreen left off. Common ground. The speaker speaks to give information. Do not assume that an older adult has received that information. They don't like to interrupt. They don't feel they have the right to question if you're in a position of authority. They don't want to appear stupid because people have, in other instances, made them feel that way. So it is the speaker who needs to take the responsibility to do some of the things that Noreen suggested. You need to have to ask questions. You have to give them an opportunity to let you know that they understand, and then you'll have successful communication.
And the 10th example for communication is with older adults, as with people of all ages, we need to focus on communication satisfaction. Lisa, you want to talk about that?
Thanks, yes. So these are really important to make sure that we're doing. We want to make sure we're communicating in a warm and friendly manner, that we're interested in the person's concerns that we're talking to, that we're listening, that we're providing clear and useful information, and that we're involving them as active participants in the conversation and the decision making. And a lot of that we covered in some of the other tips, but these are really critical to make sure that the communication went well.
That's a good summary.
Yeah. So age discrimination is a major problem in our country and in our community, and we're hoping through this effort to help people better understand what it means and identify it when they see it and work to overcome it, to change attitudes and help everyone arrive in a place where they're not judging people based on their age or their ability. We want Salem to be a city that works for and welcomes everybody, and part of that means addressing discrimination in all its forms. And Salem for All Ages is taking a very intentional focus on public information to educate people around age discrimination and help overcome that. Age discrimination results in harassment, it results in scams, it results in abuse, and we want to make sure that we're addressing it and taking it on head on. So we can continue working towards a community and a country that is free of age discrimination, giving older adults, as they age, the respect and the dignity that they rightly deserve. So thank you all for joining us today. Please visit salemforallages.org and find out more about the initiative to make Salem a community that works for people of all ages and abilities.
Thank you.
Hi, I'm Beth. I'm 61.
Hi, my name is Brendan and I'm 82 years old.
My name is Dennis. I'm 70 years old.
I am Gwen, and I am 80 years old.
I'm Hale, and I'm 92 years old.
Hola, I am Luz, and I am 68 years old.
Hi, I'm Thomas. I'm 69.
Hi, my name is Hannah, and I have the gift of 85 years.
I've been in a wheelchair since I was 17. I went to law school when I was married, had a 3-year-old and a full-time job.
I was a teacher and administrator in the Salem Public Schools for 37 years. I served on the Salem School Committee for 12 years, and I'm still politically active.
I'm committed to historic preservation work as I am the president of the Salem Common Neighborhood Association, as well as the treasurer of the Nahant Preservation Trust. I enjoy helping younger colleagues meet their new challenges through executive mentoring.
I am committed to Salem and serve on numerous boards. I am passionate about Black history, and I lecture on Salem's Black history.
I'm a published author of 2 astrophysics textbooks and also a series of books on my family's history during World War II. I became a volunteer caretaker of Almy's clock because someone had to.
I have led walking tours, boat tours, and trolley tours. I'm an amateur photographer, and I've been told that I'm getting very good at it.
I have time to exercise daily, to walk, to go to the gym, to stay active, and to keep my body and mind in shape. I enjoy interpreting in English and Spanish information to parents and guardians to receive educational services.
I have volunteered on numerous boards, including Salem's Race Equity Task Force. I wrote my autobiography, Here's What Happened, a Black Man's Discoveries and Decisions.
I am determined.
I am a caregiver.
I participate.
I am influential.
I am a persistent guy.
I am creative.
I am resourceful.
I am savvy.
Defeat
Age
Discrimination.
Today.
Defeat
age
age discrimination
today.
Defeat age discrimination today.